Good evening, everyone. My name is Leigh Caplan. I'm a diabetes nurse educator with the Sunnybrook Academic Family Health Team. I'm also your moderator for tonight's event, where we'll be talking about 3 key questions answered by registered dietitians. I'd like to thank all of you who are joining us remotely this evening. March is Nutrition Month, and so what better time to have several of our registered dietitians weigh in on topics that can make a big difference in our lives. We are really fortunate to have a fantastic lineup of speakers from the Sunnybrook Academic Family Health Team. We hope you all find the topics they'll be discussing to be both interesting and informative. Jill Zweig will kick off the talk with her presentation on why meet with a dietitian. Marsha Feldt will then talk about where to find reliable nutrition information. And then Karen Fung will present on how to meal plan in challenging times. We'll set aside some time at the end of the evening for you to ask our panelists of speakers some questions. Thank you to everyone who has already submitted questions online. Please feel free to also send your questions while the presentations are happening through the webpage. We may not be able to get to every question, but we will do our very best in the time that we have available. So to begin the lecture, I'd like to introduce our first speaker. Jill Zweig is a registered dietitian and certified diabetes educator in the Sunnybrook Academic Family Health Team. She has worked in the area of diabetes education for over 20 years. She enjoys working with clients to help them live life better with diabetes. Jill is a tutor in the University of Toronto Medical School for the Community Population Public Health course. Outside of work, Jill enjoys spending time with her family doing outdoor activities. Jill, the microphone is yours.
Thank you, Leigh, for that introduction. So welcome everybody this evening to our March's Nutrition Month speaker. And I'm going to start off by talking about why meet with a dietitian. But before we answer the question, why meet with a dietitian, let us look at the definition of a dietitian, also referred to as registered dietitian or RD. The word dietitian is derived from the word dietetics, which comes from the Greek word dietia, which means way of life. Nutrition plays an important role in the cause, cure, and prevention of many diseases, health conditions. Many of these date back to the origins of history itself. Dietitians are trained to use the most up-to-date science and translate it into practical guidance. Dietitians are regulated healthcare professionals that use their expertise in food and nutrition to enhance the lives and improve the health of Canadians. Dietitians use the science of food and nutrition to help people understand their connections between food and health, provide personalized guidance to meet individual needs and goals. As a registered dietitian, you must be a member of the College of Dietitians in Ontario. The College of Dietitians is accountable to the Minister of Health. The Minister of Health monitors college activities through the College Performance Measurement Framework, which is an annual reporting tool. This is to ensure that processes and proceedings are regulated for dietitians, that these processes and proceedings are transparent and fair and carried out, set out according to the laws of the Regulated Health Professionals Act and the Dietetic Acts developed in 1991. There is a process in place for transparency and a fair way to investigate any complaints from the public. Public members are appointed by the Ontario provincial government to represent public interest at the college, and any council meetings and disciplinary hearings are open to the public. What are the qualifications of a dietitian? Well, in order to become a registered dietitian, one is required to complete a 4-year degree in food and nutrition from an accredited university. Courses include topics on the following: sciences, human nutrition, administration, and humanities. After completion of the 4-year degree, one must complete a practical training year or dietetic internship, or you may complete a dedicated master's program, which must include a practicum component. After those 2 educational opportunities, one must pass a national licensing exam called the Canadian Dietetic Registration Exam. All regulated healthcare professionals must stay on top of new research, maintain their skills and techniques. Dietitians are required to complete a jurisprudence, knowledge and awareness exam every 7 years, as well as complete an annual self-assessment tool. Now, some of you may be asking, well, what's the difference? We've all heard the terms registered dietitian, RD, nutritionist, holistic nutritionist. I'm just going to take a few minutes to explain some of these terms. As I already explained what a registered dietitian or RD must be a member of the college, the following are other titles. So a nutritionist. This is not regulated in the province of Ontario, which means anyone can legally refer to themselves as a nutritionist, and they can provide nutrition advice, medical nutrition therapy, regardless of education or training. There is nobody regulating this title, and there is no protection to the public in Ontario. A holistic nutritionist. Well, the holistic nutrition is a more natural approach to health, and it uses evidence-based techniques for diet, lifestyle, and detoxification. But holistic nutritionists are not regulated healthcare professionals, and they are not government regulated. They do have some qualification and they do have some education. So if you are going to look for a holistic nutritionist, you might want to look for a certified nutritional practitioner. They're holistic nutritionists with a diploma in applied holistic nutrition. This is recognized and approved by the Certified Nutritional Practitioners Council of Canada. But again, they do not have a college, thus there is no scope of practice, no monitoring information or counseling provided, and no support for the public. As an individual, you have the right to access various types of healthcare professionals. You may work with any practitioner who you choose. We just want to make sure you're making an informed decision. What's the role of a regulated healthcare professional? So what does the college do? Well, the college provides public protection. It also provides enforceable professional standards. So there are definitely high academic and practical training standards that one must meet in order to qualify to be able to be a member of the college and in order to practice under the college and have a license as a registered dietitian. One must be accountable to practice under the laws set out by Regulated Healthcare Professional Act and the Dietetics Act established in 1991. As I mentioned, each dietitian must participate in quality assurance programs to ensure continuing competency. Under certain circumstances, dietitians and employers have an obligation to report dietitians who are not practicing ethically, safely, or competently. The college has an official complaints process available to anybody who has concerns or complaints about a dietitian, and the college has the responsibility and power to take action and investigate all complaints. Interestingly enough, I found some research on this topic. In November 2020, so it's current research, Healthcare Policy Journal published a study. And what the study looked at, the objective of the study was to identify whether the Ontario general public understands the difference between a registered dietitian and the term unregulated nutritionist. And they wanted to also determine if the current landscape of the word nutrition and the gaps in healthcare policy around this term are a potential harm to the public. So 402 people were surveyed, results were collected and analyzed. Interestingly enough, more female participants were in the study than males. I don't know why that is. But 64% of survey respondents indicated that there was a difference between a registered dietitian and the term nutritionist in Ontario. But only 25% of those individuals were able to correctly identify the difference. So basically, this slide shows that, as I said, 64% were able to identify that, and I believe I can use my mouse here, that yes, they knew there was a difference, but really not many were aware of what the specific difference was. So the question becomes, the public's inability to differentiate between nutrition providers is concerning, given that RDs, or registered dietitians, are the only regulated healthcare professionals in Ontario. So does this study provide justification for proposed legislation adjustments to the Dietetics Act and the Regulated Healthcare Professionals Act to protect the term nutritionist? So at the end of the study, they actually made some recommendations. And the first recommendation was to protect the title of nutritionist exclusively to be used by registered dietitians. The second recommendation was to make amendments to the Regulated Health Professionals Act to protect the word registered exclusively for registered healthcare professionals, and to protect the term medical nutrition therapy as a controlled act specifically to be performed by registered dietitians. These amendments would minimize confusion for the general public regarding the education levels and the experience of nutritionists versus dietitians. This is especially significant with the growing increase in numbers that we see in terms of chronic disease management. And these numbers are continuously growing in Canada, based on a Statistics Canada 2014. So in conclusion, the study showed that although the public recognizes the difference between the two terms, majority of people are unaware of what the difference is. So with the lack of understanding the potential risk for harm, no regulation of the term medical nutrition therapy or nutrition, would it be beneficial to the public and reduce the potential for harm if we regulated these terms? Interestingly enough, there are a few provinces in Canada that have regulated the term nutritionist and protected it. That's Nova Scotia, PEI, Quebec, and Alberta. So those provinces, only registered dietitian can use the term nutritionist. I thought I'd pop this slide in because I think it's kind of fun. Eating a diet rich in vibrant colors does not mean a bowl of Skittles. So as a registered dietitian myself, I use this as an example of where somebody might talk about the importance of using color in diet, as where I'm going to talk about the importance of using color in diet, as well as the significance of the what we call vitamins and minerals and other health benefits to eating a variety of different foods. We work with different individuals based on individual needs, preferences, likes, dislikes, to help prevent disease and help with health promotion. As a dietitian, I'm going to take this opportunity to challenge all of you out there listening to me tonight to add more color to your diet. So I'm going to come back to this, but have you thought about adding 2 different colored vegetables to lunch or dinner a couple of times in the next week? But now let's talk about why meet with a dietitian. So as we've already discussed, dietitians give you accurate and timely nutrition advice and information. On my slide, you can see a variety of different topics that we might cover, from medical nutrition therapy to food and mood, to emotional eating, to eating disorders, to something called FODMAPs, to what is a carbohydrate, what's protein, how can we help with heart health, it can help. And then there's other general reasons: improving your eating habits, exploring one's relationship with food, disease prevention and management, as many of my pictures show. We also work really hard at debunking myths. And I say debunking myths in the deep, dark world of food that we all live in and we're all exposed to 24/7. One of my favorite sayings after many years is, as a dietitian, I'm really not here to tell you what you can and cannot do, but I'm here to educate you on how food works in the body and how can you make better choices more often, recognizing that nobody makes the best choice 100% of the time. We're all a little bit human. Where can a dietitian be found? A dietitian can be found in many different places. So we work in hospitals, we work in healthcare facilities, we work in long-term care, we work in family health teams, community health centers, recreation and sports facilities. Dietitians are very involved in food and industry, in research, in forming public policy, in academics, in teaching at college and university levels. We're involved in private practice. Our influences run deep and continue to grow as we become a more recognized healthcare professional. Just want to mention here, and I think Marsha may mention this later as well, dietitian services as part of hospital, family health team, long-term care facilities are often covered by government funding. If you don't have access to any of those facilities, many private health insurance companies are covering the services of dietitians. And you can certainly lobby your workplace or health insurance to work towards covering more and more healthcare professional services, such as the services of a registered dietitian. Some people are willing to pay out of pocket, and though that's sort of more in private practice. So that's an option as well if it's available to you. And really, just to summarize, facts about dietitians. Dietitians are experts in medical nutrition therapy, and we provide accurate scientific information. Dietitians are not the same as nutritionists. We work in a variety of diverse roles. We are compassionate, friendly, caring people who translate the art of nutrition into everyday advice for health promotion and disease management. We are involved in many different forms of research. We help to correct harmful and erroneous information. We help to motivate and empower people to make healthier food choices. I think the relationship between a client and a dietitian is really one of mutual trust. And sometimes we have to build that. I chose a quote to summarize my presentation from Dietitians of Canada. And it says, whether you are looking to improve your relationship with food, manage a health condition, or to enhance athletic performance, dietitians can help. No fads, no gimmicks, just up-to-date science and a commitment to helping you understand the connection between your food, physical, mental, and emotional health. And again, it's in my blood just to say, can you challenge yourself to make a healthier choice more often? So choose 2 different colored vegetables at lunch or dinner 3 times in the next week. Thank you. I'm going to pass the floor over now to Marsha.
Hi, everyone. Nice to meet you all. And I'm really excited to be here today to celebrate Nutrition Month. We always like to do this every year. There's some sort of event that we try to participate in or create. in order to share our knowledge around nutrition. I'm really excited too that even one day of the month is dedicated to dietitians, and that always makes me very proud to be a dietitian and also to be here tonight. It's very fun to actually do a presentation with your colleagues. So that's always like a great opportunity for me to learn from them, as well as, we're always sharing information and working together on any of our projects that we do. So today I'm going to be looking at where to find reliable nutrition information. So let's get started. So next slide. Okay, so as you can tell, here she is with her computer, sitting in the kitchen about to prepare a meal. I don't know what she's thinking. Maybe she's following a certain diet. Maybe she's not. I don't know. Like, it's hard to tell. But she really looks like she's got a lot on her mind, right? She wants to know something to follow, recipe, whatever it is. But when it comes to food and nutrition, the reality is that not everything you read online can be true. We seem to know this, but it's still really easy to be taken in by all the popular nutrition trends that are out there. There's lots of diet trends, lots of products, and now even lots of posts and blog posts that sort of talk about nutrition information. It's like everyone's an expert, right? But what we see and we hear online, how do we determine, what's the truth? What's the fact? What's the fiction? How do we decipher this? What's going to help us? And I really want to share that with you today. There can be a lot of misleading information online. And it can really affect us. And in fact, I don't think it affects our generation as much as it affects the younger generations now. You'll see a lot of movie stars posting information, a day in my life, and telling you exactly what they're eating for the day and making it seem like they know everything about nutrition. I find that really, really eye-opening. I find it really, really incredible. And from that, sometimes people, I don't know if you've seen that commercial about the pharmacist. Well, people go down a rabbit hole trying to search out information. That can happen with nutrition too. There can be a lot of wasted time and energy and even money on products and different things that people want to do. And some of it I know people are posting online to share their ideas. But again, they might be good people and nice people. But at the same time, we really have to say, are they reliable and creditable? So this can often be where, we have to sort of think a little deeper and take on some of that personal responsibility. So I want you to consider some of the questions that I'm going to show you tonight so that you can help spot some of the faulty nutrition information or sort of challenge yourself. Is this really, really true? Okay. And that will help you hopefully when you're reading an article, looking at a blog post, discussing with a friend, or getting news. Sometimes those news articles come out and we're not really sure what to think of them. So reliable information means that it's good in quality, right? That, reliable means that it's going to perform, that you actually, you're going to be able to use that over and over again. And that it'll be trusted. This is what we need for our health. So let's go on and get to some of the facts. So really, these are some questions that maybe will help you. They could help you decide if the information that you're reading is reliable or not. These are red flags. I don't know, when I'm always looking at these posts online, you might be looking up on a website and all of a sudden someone, they always put a picture of someone and wanting to change their body. They try to grab on your emotion, and they're really looking for sensationalism, trying to sort of say this is going to be a cure-all or a quick fix. that's a red flag. Okay, because a diet product that's going to do everything for you is going to be too good to be true. That it would solve all of your nutrition concerns just by taking that one tablet. Wow, we only wish that were true, right? So these fad diets, they often also, like if it's 7 days, you can lose 7 pounds, or 30 days to get your body in shape. The quick fixes can lead to this all or nothing thinking. That it's just black or white. If I don't do it this way, and if I do it another way, then I'm failing and I'm off the wagon and I can't truly be healthy again. So that can really be hard on us. So in fact, when we're making change, and we know this, when we're making change in any habit, and especially in our eating behavior, it's not just a quick fix and throw everything out of the kitchen, bring all the new stuff in. In fact, you've kind of got to work with it. You've got to be planning, problem solving, and you need some flexibility, like Jill was talking about. We need to know that it's not going to be perfect all the time. There's going to be times when you're going to have chocolate, or you're going to have a cake or cookies, a birthday. That's going to come up. But what you're doing every day is going to matter more. Okay, the next thing we can look at that might be a red flag is the study, is the advice based on a single study. It could be that the study is great, or it may not be. It might be drawing the wrong conclusion. It might even be biased to the product that they're trying to tell you about. So this is something you really have to be aware of. It takes a lot to really come up with a change in nutrition. You need multiple studies because we need to learn from them. We're learning from the various results to come up with conclusions that might even help us, or learn about a condition that may help people. And we're looking at, helping a lot of people, and in order to get that result. So the more there is, the more of the research studies that go in to prove that, the better. And these are called meta-analysis. And what we can do with those meta-analysis is combine multiple studies that are looking at similar populations. They look at similar questions, and then we can analyze what are the results, how do they compare, and from that we can see what the best advice will be. There's lots of research studies that are out there that are bigger in size. Like, we have to think of how many people they're trying to study at one time. That can really help us too, because if there's a larger and more diverse population with that result, that'll give it stronger evidence. And that's what we're looking for. I mean, the smaller studies matter too, because it does help us in the long run to go on and learn and develop and sort of understand. And we're also looking at the duration of the study. How long is that study taking place? Was it over a week? Was it over 3 months? Was it a year, 5 year, 10 year? Of course, if the study is going longer, then the results that they're getting will become even stronger. Let's look at the next, looking at the information. How is the information presented? Is it presented as like a personal opinion that someone is just saying, this has been working for me, I'm really happy, it makes me feel great? What are they sort of coming up with? Is it like a testimonial? These kind of things are red flags, because a success story like that from an individual or a celebrity or a person isn't really proof that that will work for everyone. And sometimes these opinions and testimonials are paid. Like, I can think of some of the hair commercials, where they take a shampoo and they put it on a movie star. Like, I don't think some of the movie stars are just using Aveeno all the time. Like, they have so many products that they could be using, but they do testimonials and endorsements in that case to make money. That can also be the case with nutrition. So what I'm trying to tell you here is that we want your nutrition advice to be based on the best research available. And the best research available looks at all those things. And also, we'll start to look at, what needs to be further discussed. They'll talk about some of the disclaimers or things that maybe didn't go so well, so that they can learn and sort of improve for the next study or what we would need to know. So I would say to you, facts are greater and more important than the feeling in this case when we're looking at nutrition advice. The next thing we want to look at are the qualifications. A lot of people will write things and you want to know where they're coming from. You want to know what type of nutrition education they've received. Are they a dietitian? Did they get a PhD? Were they doing a master's? Where are they coming from in the world of nutrition to bring this information? And how are they doing that so that they can guide you? That's really important. Often on the websites or even in the nutrition book that you're reading or the article, you'll be able to find some information about the author. At least I hope you will. And then you'll be able to find about the people or the company that's responsible. And are they credible? Can they stand behind their product or whatever it might be with the evidence that can prove that this can be some advice to follow? And the last thing that I think may help you, these are just some questions. I'm sure there's lots that people want to use. These are just some of the ones that I thought might help you. But also, is the recommendation that the person is making or the advice in the article sustainable? Sometimes there's these ideas that you've got to get rid of everything and you can't eat this food or that food and you just have to eat grapefruit, for example, for the next week or so. How sustainable will that be? If nutrition's complicated and complex, there's macronutrients that we need to sustain healthy living. There's micronutrients like vitamins and minerals that are really important. And there's also things that we don't even know yet about food. And especially when it comes to the color of the food, like we were talking about, there's nutrients in there like phytochemicals that can help us as well in food. And dietitians approach it in a way where we want to use food to make you healthy. So we really deal in real food most often. So that's where we're trying to get you to most of the time, is looking at food and how we can fit that in based on your lifestyle and based on the needs that you have to live a healthy life. So those are just some questions to think about. Now I want to take you to some of the credible sources of information that I think you should look at. So the next slide. This is Canada's Food Guide. And I don't know if you've checked it out in a while. You can see it online or you can pull it up on your phone. It looks really nice on the phone now because they tried to design it so it would look really good on a phone when you want to look at some nutrition information. This guide was updated around 4 years ago in 2019, and it's a sustainable approach to healthy eating. It's looking at foods from all the different food groups so that you can get your micronutrients and macronutrients. It's based on meeting the needs of most people, for their vitamins and minerals. And this was developed with nutrition experts in mind, dietitians and PhDs and other people that would know a lot about food. So I'm hoping you'll check it out. You can go to various sections on the food guide. The main one are the healthy eating guidelines. And the guidelines are going to show us, similar to what the plate is, what are the foods to be choosing every day? What is the pattern of eating that will help deliver us with good nutrients each day? I also like to look at the different things that they have in that section on food choice, which can look at even food labels. They've updated that recently. If you ever want to learn more information about food labels, you can look up there and find out lots of information on how to read a food label. There's information on food marketing, grocery shopping tips, and more. Then there's a section on healthy eating habit. And we sort of talked a little bit about it already. But eating habits also really important to consider. It's not easy to eat healthy every day. We're not expecting that, but there are some things that might be helpful, such as being mindful, like trying to build on that relationship that we have with our food. And that's what I think is so sustainable about the food guide, is that they pay attention to building a healthy relationship with food, using your senses, creating a good food environment to eat in, raising awareness around just even your eating habits by asking you some questions, looking at cooking, how to rely on some of, or build some cooking skills, not to be relying so much on processed food. In the cooking skills, you might be looking for ways to save time when you're cooking, or easy ways to do it, or I like to say, cook once, eat twice, so you can use your dinner as your lunch leftover, and ways to save money without avoiding that cost and the cost of eating out or takeout food, because we're going to go on and talk about food budgeting today, and ways to eat with the high price of food. And then to enjoy your food. I really think this is so important, to sit down, take time to eat, and be open to try new foods, or create that environment where you're eating with others, to share food. Again, that's building on the relationship. That's all part of the guide. And there also is a section called the Food Guide Kitchen, where you could get inspired by different recipes, tips on cooking, planning meals, food budgeting, and just enjoying food that we are accustomed to with our traditions and our cultures in mind. And then the next thing that I thought I would show you as a reliable place to go for information on food is called Unlock Food. This is the website. It's called unlockfood.ca. Unlockfood.ca is a bilingual, and actually it's won some awards too. It's brought to you, it's sort of made by the Dietitians of Canada. So this is written and reviewed by dietitians. And it's to help Canadians connect also to dietitians, but to find nutrition information that's reliable. So information about food and information about various topics of nutrition. So what kind of information can you find on the website? Hundreds of things, hundreds and hundreds of things. And there's recipes, videos, and different things, but you can find topics from A to Z, but I'll just tell you a few. There's healthy eating through the lifestyle. So you can see from, how to feed baby to what to consider in our aging years. You can look at, different things that might interest you around health conditions. You might be looking at diabetes prevention, for example, or learning about blood pressure, cholesterol. You might have digestive concerns. You might want to know a little bit about celiac. All of these things, or heart health, or allergy. There's so many things on this website that you can look at. The thing that's really amazing about it too is that we use the dietitians use the practice-based evidence in nutrition database to come up with the information that's presented in the articles that are on unlockfood.ca. So it's very credible and reliable nutrition information. The PEN system is actually for nutrition practitioners. And what the PEN has is current guidance on food and nutrition. So it offers evidence-based answers to the questions that may come up for anyone, and there's a knowledge pathway. I've actually developed one of these myself and contributed to the PEN. And I did something on exercise and diabetes. And what I had to do is a complete review, and I looked at many studies, and I had to grade them and come up with the evidence and sort of show that what I'm saying actually is going to be telling us how to exercise and what we can expect with our management of type 2 diabetes or type 1 diabetes. So I looked at that and made a pathway. It was really great. I really enjoyed doing that. I should probably do it again. And then, you can see now that PEN has grown, because not only is it dealing with the dietitians in Canada, actually we're connected to the British Dietetic Association, the Dietitians of Australia, and the Dietitians of Canada have all come together to contribute to this practice-based PEN tool that we use for Unlock Food. So just to tell you a little bit about Unlock Food. The other thing that I wanted to share with you, the next slide, is another tool that I think you might find helpful. It's called Cookspiration. This is an online tool for looking up lots of things to inspire you around making healthy meals and even menus. So you can look here at, I put one up on the left-hand side. I'll do the menu planner because I thought that was sort of interesting for people, but you can choose up to 2 styles of eating as your goal. And what you'll get is a generated menu for recipes from this website. They've got vegetarian, they have dairy-free, they have all sorts, budget-friendly. You can combine 2 of those and it'll give you a week's worth of menus with different recipes. So that's kind of neat. Again, it gives you ideas. This is another way to sort of help you. These recipes and this funding, I just wanted to let you know, came from some companies as well. So Canadian Lentils has contributed. There has contributions from dairy farmers, and Loblaws has contributed. And then there also are dietitians within that group, obviously, that are posting. And then there are just dietitians themselves that post recipes. And on the website, you'll get to use this tool, which is really interesting too. You see with the little sunshine here, it shows you, say, for example, you can pick a day, Monday, Tuesday, Wednesday, Thursday, Friday, whatever, because then it'll generate different recipes. And then you can pick a time of day. So this is late afternoon, but you could do like breakfast, lunch, dinner, whatever, afternoon snack, late night snack, and then you can pick a category. So there's a lot of flexibility. And then when you do pick a recipe, it'll pop up similar to this mango chicken wrap. It'll give you your ingredient list and then how to make it. And then it's got the nutrition facts label at the bottom. And they'll usually tell you who the contributor is. So I thought that was really neat to share. Okay. So I've given you a few of the resources that dietitians have created or contributed to. I do want to talk a little bit more about dietitian services. Jill had started that. I just want to add a little bit more to what Jill had talked about. So the next slide. So I wanted to let you know that some dietitian services are covered by provincial, like our OHEP. So what you can do in some cases is get a referral to a clinic which may have a dietitian involved. So there are various clinics that might be available. It just depends on what you're connected to. But for example, you may get a referral if you're going through cancer care. You might get a referral to a dietitian there. If you've had an issue with your heart, you may get a referral to a cardiac dietitian. Or if you have kidney disease, you might get a kidney dietitian. Just there are a few. And then a family health team might also have a dietitian, as long as all sorts of other practitioners, or a primary care network. You may find dietitians in public health units, and again, community health centers, where those dietitians, you can work along with them and that would be covered. Home care services, dietitians come to also provide care to people around their diet and when you're at home. If you need that, say you come out of hospital and you're in your home environment, you need to have someone come in to help you with services. Dietitians can come meet you there. And then all of us, we work in diabetes education, so you can meet with dietitians in a diabetes education program. And then, of course, long-term care homes also have dietitians. The next slide tells us a little bit more about the private practice dietitian. And in fact, when you go on to the Unlock Food, you'll find a link. So you can find that it'll link you to dietitians.ca and the find, and you can look up by postal code or area, or the area that you would like to, if you wanted a dietitian to help with digestion, then you can look up, or if you want it for your heart health or weight loss, you can choose a category. And in this case, you could get hopefully some coverage from your private health insurer, or you pay out of pocket. Okay, there's so many dietitians out there, that contribute to like websites and blogs, and do talks about nutrition. Like, there's lots of dietitians out there that are very interested in doing things like making cookbooks and writing articles, like Leslie Beck, I can think of. Like, there's so many dietitians out there looking to help and connect with you. And it's just so nice to be able to talk about that a little bit today. So I'm glad we could share that with you. And we're hoping that, like Jill had said, that more employee benefit plans will cover. I know that the government has taken that on, and even for public service workers, there's more coverage for dietitians in the government, but we're hoping that more companies will do that too. I'll just share with you a dietitian in private practice on the next slide. This is just an example of a dietitian that's done some work. Her name is Abby Langer. She has this website called Abby's Kitchen. It doesn't necessarily mean, she's the only one out there. There's many lovely, lovely dietitians to work with. I just chose her because I remember some of her blog posts and videos were really interesting because they sort of dispel some of the nutrition myths that I've been talking about. And she's been a very strong advocate for some of these sort of like, look at my diet in the day, like the things that are going on around diet culture that have been really, really difficult for a lot of eating disorder behaviors. So she's been doing blog posts to sort of work with that. And I've seen a lot of responses to her blogs and her videos with a lot of people saying, thank you for helping me. She's got recipes and courses and services and cookbooks, like, these types of things. And she put together this website. So I thought it was kind of interesting to share. But there's many dietitians, and sometimes just adding cookbook and dietitian to the back of your search, like, so, cookbook and dietitian, recipe and dietitian, will sort of help you get to some of the dietitians when you're doing an online search. Okay, so just to end my section here, I just wanted to say thank you again for the opportunity to talk with you. I'm really glad to share some of this information, especially during Nutrition Month, make it special. And then I just wanted to say that, you got to do some looking. We want you to be personally accountable. But in fact, we're here for you too. So, we want you to share information. So if you do find information that you're really interested, I know people are creative, they're looking everywhere for information, really want you to be able to talk with us when you come see us in clinic, share with us so we can help you navigate and answer some of those questions about the nutrition information you see online. Thanks so much.
Thank you so much, Marsha. That was a lovely and very inspiring, interesting talk, just as Jill's was too, and looking forward to Karen's. I just want to let everybody know a little bit about our dietitians are very humble. They don't like being in the center stage, but Marsha has been a registered dietitian and certified diabetes with an adult population for over 20 years. And she really enjoys working with clients and helping them to live well with their diabetes. So thanks again, Marsha. And
thanks, Leigh.
Now I have the pleasure of introducing our next speaker. But I just want, before I do that, I just want to remind everybody who's watching, if you please send in your questions so that we will be addressing them shortly. Now I have the pleasure of introducing our final speaker, Karen Fung, who's a registered dietitian. Karen comes with a wealth of knowledge too. Her focus is to provide practical nutritional information to the outpatient community setting, with particular interest in diabetes, weight management, and elder nutrition. Being bilingual and from Hong Kong, she is passionate to advocate for patient health and nutrition education in the Asian communities that maintains strong cultural considerations. She completed her studies in McGill University and also holds a Bachelor of Medical Science degree at Western University. Outside of work, she enjoys experimenting with food and coffee. So here's Karen, and take it away.
Thank you, Leigh. I'm just going to share my slides as well. Bear with me. So thank you so much for the introduction. I'm, again, very excited to speak to everyone today. It is Nutrition Month, so, we're really trying to highlight as much information about nutrition and for our fellow dietitians as well. So my next topic is really to discuss this really challenging time with groceries and with budgeting, with various costs rising. And I think it's just something to maybe helpful for tips and tricks, some information that maybe you didn't know about. So just some statistics. I think it's always helpful to learn about what's really happening in Canada. But as we've all seen, there has been a great food price rise and cost rise in the recent months, and especially in the last couple of years. There was the pandemic, there was COVID, and there were all these other extenuating factors that sort of led to this. But every year, the Dalhousie University, amongst other universities, they group together and they create this Canada's Food Price Report. And the newest one in 2022, each year they actually predict what the food price increase would be for the next year. And, then they reflect on their past predictions and they talk about all the different factors that might have led to that. And their prediction for 2022, when they did the prediction in 2021, was that there would be a 5 to 7% of the food price increase. But in reality, when they did and prepared the report in 2022, they saw that by September, there was a 10.3% increase in food prices. And I think we all saw that as well for a variety of reasons. And in the report, they're predicting that for the next year, that a family of 4 will spend up to $16,000 per year on food. And this would be an increase of $1,065 from what was observed in 2022. So we're expecting more food price increases. And of note, they are predicting that in 2023, vegetables would have the largest increase, predicted 6 to 8%. We also know that food banks have really been, the use of them have increased by a lot. They're quoting, I don't know what happened there, 15% increase. Usually in the summertime is when there's a slowdown in the food bank usage, but they did not see that in the summer of 2022, which is concerning for the food bank world. And food affordability is really a nationwide problem. So hopefully from today, we can learn a little bit about some ways to save, maybe cut down on food waste as well, but really kind of coming up with some ideas that we can plan better and kind of be a little bit more efficient with our food. So I will go through kind of how do we plan, some tips and some ideas for planning, the shopping aspect, how can we promote more efficient shopping, buying smartly, and then some tips and tricks on preparation as well. So Marsha and Jill had sort of introduced us to the Canada's Food Guide. Again, it was updated in 2019. So really using this as a compass of preparing some of our recipes and maybe using some of those recipe websites to put together our plan. That is usually where I encourage people to start. We want to have a variety of fruits and vegetables, right? We want to have them at every meal if possible. And ideally, we want to have lean proteins at every meal. We want to have whole grains potentially in most of our meals, if not every meal. And using those recipes, I generally encourage maybe planning 3 to 5 recipes per week and having that kind of in mind. Keep just doing that. As opposed to all 7 recipes planned out, there are going to be some changes in your week. So it generally is a bit easier to plan 3 to 5 recipes. Again, you might find that for your household, 5 is better, 3 is better, whatever the case, but this allows for some flexibility and some changes in the way that you use your ingredients so that we don't waste the food that we're purchasing. In terms of fruits and vegetables, I really like this site where you can Google it. It's called the Produce Availability Guide from Ontario.ca, and they really show us locally when we should be purchasing certain fruits and vegetables when they're in season. And this is helpful because they tend to be cheaper during those times, and they tend to be much better quality. They are also, at their height of the nutrition value. So we encourage, buying asparagus in May and June in Ontario. And because we live in this modern age, we might import a lot of fruits and vegetables as well, and that really drives up the cost. So knowing which fruits and vegetables are in season locally can help cut those costs as well. In some cases, we might still want to have certain fruits and vegetables out of season because we live in a climate that's not always, produce friendly in some months. And as Jill, is also mentioning, we want to challenge ourselves to eat the different colors of the rainbow throughout the week of our fruits and vegetables. So you might opt and consider frozen. Frozen's a great way to also minimize food waste. They stay in your freezer for a good amount of time, and you can use them as you wish. Nutritionally, they're very similar to fresh. The only difference I find really is the texture. For protein, we want to consider using more plant-based options. So we're talking about legumes like beans, lentils, chickpeas, as well as tofu or other soy products, and our nuts and seeds. And finally, whole grains, especially intact whole grains as opposed to whole grain products, tend to be a bit cheaper as well or more budget friendly. They're also very nutritious for us. And, because we're part of SUNDAG and the diabetes education program, we're always talking about how it affects your blood sugars, and they tend to be a bit more helpful with managing our blood sugars, the intact whole grains. And of course, they're packed with nutrients, different vitamins, minerals, and fiber. So those are kind of the meals that we want to build our healthy plate on. Choose the recipes that would include some whole grains, maybe ones that we don't tend to cook. Maybe it's a new recipe once a week or once every couple of weeks. We have our favorites, right? Think about those lean proteins. Can we add even a plant-based option as part of the meats if we tend to be meat eaters? Again, Jill mentioned, can we eat the different colors of the fruits and vegetables in our week? We also want to plan for snacks. So fruits, nuts and seeds, some of those finger vegetable versions like the small cucumbers or the cherry tomatoes are really handy as well. And then some calcium-rich foods like yogurt, cheese, and of course your milk and milk alternatives are fantastic to stock your fridges and your pantries for. And of course, these tend to be quite minimally processed and again, generally budget friendly. Recipes, I talked about choosing a couple of recipes per week so you know which ingredients you need. Lots of cookbooks out there. Marsha gave us a really nice tour of Cookspiration and unlockfood.ca. In terms of more budget-friendly locations, the Cookspiration is great for choosing that as well. I really liked Budget Bites, which is a website that breaks down all the different ingredients and how much it would actually cost to create that recipe. I don't think it's super up to date in terms of the costs and the recent rise in food prices. And I do believe it's a US website, but it's helpful to sort of understand and helpful to see it in a way where you break down, the 1 teaspoon of, cayenne pepper that you're using. That in the grand scheme of things, it's not that expensive. And I also really like pantry recipes. So one that I just found was on Love and Lemons, and they looked at different ways we can incorporate pantry items that we always have around. And that's a really easy and handy and generally very budget-friendly way to include some healthy foods. Lots of different apps that we can find. Cookspiration has an app as well, and it could be handy to bring with you to the grocery store. You have your list in front of you, you won't miss any items. And then, of course, our favorite magazines. We might take a picture now, bring it to the grocery store. We might rip it up and bring it with you. So keep your recipes. It's really helpful to just know and kind of have a bit of a layout, all the different recommendations you've heard, eating fish 2 to 3 times a week, minimizing your red meats. How do we do that if we didn't have that plan ahead of time? Another thing that we wanted to highlight is a basic healthy kitchen. These are items that we really want to see stocked often. And this is that point where you check your kitchen and your pantry and your fridge. Do I have these items? Do I need these items? Are they part of the recipes that I'm about to be preparing? A highlight for the pantry, especially because these are, again, very budget friendly. Oats, brown rice, quinoa are very popular. We have farro is one of my favorites. Barley, bulgur, fantastic intact whole grains that we should try to find more recipes and incorporate a little bit more frequently. Of course, we have our whole grain breads and pastas. If you're a family that doesn't go through a lot of bread, try freezing them, the sliced breads. It's a really great way to still have some on hand for convenience, but not, feel the pressure to have to eat the whole loaf just because they're going to go bad. And then a few other notable pantry items are the dried beans and lentils. These one you do have to prepare in advance. I find that lentils are a bit easier to cook without soaking them ahead of time, but certainly beans and chickpeas you should soak ahead of time. Canned items, this is where we want to be a little bit choosy with choosing low sodium versions whenever possible. I really do enjoy the beans and legumes that are canned. They tend to be low sodium, but do double check the labels. Canned tomatoes are fantastic to add to broths and create kind of a stew, right, for pasta sauces. And we want to choose low sodium whenever possible. Low sodium broths are very handy to create, kind of like a mishmash of soup from all the vegetables that I need to use up. And of course, our canned fish are fantastic. There's lots of choice for nut butters and seed butters now as well. And getting them on sale is very handy. The freezer, don't forget the frozen fruits and vegetables are very helpful. Lean meats we want to include. Fish is a great way to, increase our variety of our proteins. And you might want to consider freezing them in packs that make sense for your family or your household. Freezing them for one portion when you have to feed 4 mouths might not be as handy. You might, use more plastic bags and things like that. And certainly freezing them in the original package of the big salmon fillet that you might get might be too much. Then you're defrosting more than you need. So consider how you're going to use them for that night or for a couple of days of recipes. A couple of favorite vegetables I like to keep because they tend to last very long are our cabbages, peppers, your onions, of course, garlic, and then you also want to include some leafy greens week to week in your fridge. Fruits, yogurts, milk alternatives, and milk themselves. Eggs are fantastic to have. And then, of course, your condiments. So best advice is to start noting when you're running out of things. I'm out of eggs. This weekend, I got to get more eggs. I'm out of milk. I got to get more milk. Communicating that with your family, if anybody is coming or going to the grocery store, that they are aware. And then, of course, before you go on your grocery trips, we want to just double check your pantry, double check your freezer, look to your recipes, and make sure that you're not double purchasing, but certainly that you're including everything on your list. So when we're at the grocery store, some tips is to I think everybody's heard of this one before, but don't go to the grocery store hungry. We tend to make poor decisions when we do that. We tend to buy more snacks and less meal items. And we tend to be much more susceptible to kind of those bulk deals, even though it might not necessarily make sense for your household. Also, check out your small local grocery stores as well, if that's available to you. The ones kind of, I just think of the ones on Yonge Street, for example. They tend to package things in smaller items. So if you're a smaller household, it might be a little bit more easy to use up those packaging. They might package like 2 bell peppers instead of the 4 that you see at a large grocery chain. Really consult the flyers before you head out. 2 apps that sort of consolidate the flyers onto an electronic version are Reebee and Flip. I always use them to check out all the different deals that are at different grocery stores. You can then save them and then sort of take with you when you're at the grocery store. And this has been particularly handy at grocery stores that honor the price match. Where you can, so if I'm at certain grocery stores and they allow price match, I can price match the eggs that are on sale somewhere else at that particular grocery store. There's a lot of nuances and rules and stipulations around the price matching. So do a little bit of research and homework before you head there thinking that I'm going to get this, deal. But certainly some things to check out is that not all grocery stores do price match. Generally, the more budget-friendly ones like No Frills or Food Basic would do that, and they tend to price match the grocery stores in the vicinity, as opposed to, if there's no superstore that's close to it, they won't price match superstore. But you can always ask the staff there, and they'll be able to tell you which stores they price match at that particular location. And then it is a matter of learning and kind of keeping track of those particular stores that you could price match for. And then they're very particular about the item itself. It has to be the correct size and kind of general characteristic. If it says organic versus it's not saying it's organic, they could reject the price match, but definitely a great way to save on some of the produce and other items at the grocery store. The other one I really like that I learned recently is you can rain check sale items. So if you go to the grocery store, there's something on sale and it's out of stock, you can ask for a rain check. And most grocery stores will honor this up to 30 days. Again, check with the grocery store that you're at. But this allows you to come back when that item is back in stock, but purchase it at the sale price that you saw it at. So very handy tip. And then finally, now there's a lot of grocery stores that have this ugly or imperfect produce section where certain items might have been dropped or a little bit squished, and they're just kind of not as beautiful looking, but they're just as nutritious. The nutrition value hasn't changed, and they're probably the same. They arrived at the same time as all the other items, and they are often offered at a discount. So this is a great way to save on some items as well. We want to check unit prices. Sometimes it's deceiving that you look at the actual price of the product, and it looks very cheap, but actually per unit, it's a lot more expensive. I find that there isn't as much of this at the grocery store on the sale tag, but more of this when we shop online. So that could be a handy way to sort of check out the grocery store online before you head there. And certainly do check and compare between different brands. There's sometimes a really big price difference between brands. And if you don't really have a preference, or you know that there isn't a big difference in the taste or the quality, then do opt for a potentially cheaper brand. And then, of course, once we have all our groceries, we want to understand how we can store them. And the general rule across the board is 3 to 6 months. Meats, they tend to last about 3 months in the freezer. Prepared foods, 3 to 6 months. And then fruits and vegetables are pretty okay for 6+ months. You can Google this really nice reference, and it would be good to have on your fridge or your freezer just to know, how long you can keep things for. But the most important, definitely for sort of this housekeeping strategy is to label. So when you put things in the freezer, try to put a date on it so that you know when you put it in. Some easy meal ideas, definitely learn how to be creative and inventive with your leftovers. How do you repurpose them? What can I do with the ingredients that I have? Sometimes you get gifted stuff, or if somebody brings something over, look up those recipes. You know, one time somebody gave me an artichoke, right? I didn't know what to do with it. I looked it up. I watched a YouTube video on how to prepare it. How do I open it, right? Now there's so many resources that we can use. I think it's really important that we try to do some of the strategies, and sometimes you figure out, well, it's not really worth my time, or I didn't really like that. So definitely try to learn the different ingredients so that you have more range and more variety. I love one pot meals or one sheet pan meal. There's a lot of those recipes out there now. It saves on time, it saves on energy, and you can really kind of go away and do something else like the laundry or dishes, or maybe just relax. And this is a great way to sort of prepare your dinner meal or even a lunch meal without standing over the stove cooking all the things. I really liked Marsha's tip and kind of that comment, you know, cook for multiple meals, right? Cook once for 2 to 3 meals. Not everybody has the time or the energy to cook every single night, every single meal. So really learning how to be able to mix and match different ingredients even, or different cooked and prepared items, so that, you know, I'm not having chicken and broccoli and rice, but maybe I can have the chicken in a pasta or a soup or a stew, or maybe I'll stir fry it with something else, with some potatoes, right? That could really mix things up and make our, you know, eating pattern much more nutritious and have all that variety that we're looking for. And we want to batch cook and freeze our foods for some of us, especially those who don't really enjoy cooking as much. That's a really great tip. And again, just double check how long you can freeze things for. A really quick example of how we can mix and match and reuse some of the items. So maybe I'll have a Tex-Mex breakfast wrap with black beans. For lunch, I will make from scratch a soup and salad. Maybe I had some ingredients for the soup left over, you know, maybe it's just some carrots and some onions I had chopped up the day before that I didn't use completely. And the salad, maybe it was a bagged salad, and a tuna casserole for dinner. But then the next day, I'm not really cooking it again. So I'm having a cereal, a high fiber cereal for breakfast. I'm reusing the tuna casserole in my tuna sandwich, and reusing the salad at lunch the day before for my salad again to make it more balanced. And then the Tex-Mex that I had for breakfast on day 1, I can use some of those ingredients and create a salad or a soup for dinner on day 2. So we're really minimizing, you know, that time spent in the kitchen cooking and maybe washing up to really help you guys with, you know, just something a little bit easier. That's all I wanted to share with you guys today. And now we're opening it up for questions. Thank you so much for letting me share all this information with you guys. And I'm sure we have lots of questions ahead, so we'll answer those soon.
So thank you, Karen, for this very informative talk. As Karen said, this does conclude our formal presentations, and now we'll begin the question and answer portion of the evening. If you would like to still submit questions, please do. There is still time. I'm going to actually pass the floor over to Jill and ask her. There was a question around too much salt or sugar in most store-bought foods are the cause of many health problems. Can they not be regulated like trans fats?
So that's an interesting question. So we know that too much sugar and salt in food contribute to risk factors for some chronic health conditions, but we don't know that they're necessarily the cause. And how I would describe that is there are many people who may eat sodium foods very high in sugar, very high in sodium or salt, very high in fats, and no matter what they do, they won't develop heart disease, they won't develop diabetes, they won't develop other chronic health conditions. So we can't say that those things are causes. Now, I'm not saying that added sugars and sodium are good for health. But we have to recognize that we don't necessarily, they aren't necessarily the cause. They are contributing risk factors. And when we have to look at food there's two components. One, yes, they were able to regulate the title or the amount of trans fat. And that's because trans fat was something that was created. It's not a naturally occurring type of fat. It was created by science. And then the research shows that it definitely caused an increase in LDL production of cholesterol, which is a risk factor for heart disease. So there was a direct cause there. And so they were able to go through with legislation to have it banned. But that took many, many, many years. This is not something that's new. I've been hearing about this for many, many years. And so we have to look at where can we find cause? I think we need more research, and maybe eventually we will get to look at modifying added sugars and added sodium to certain foods. What I think you also need to recognize is it's very much individual choice. So freedom of choice. So there are many healthy options out there. There are many crappy options out there. And that's where a dietitian can help you, as I mentioned earlier, help you make healthier choices more often within what's going to work for you and your world of food and eating habits. So hopefully one day the government will look towards a little bit more regulation in terms of health. We certainly have come a long way in terms of banning trans fats, adding caloric value to fast food chains. It's available either online or certain places it's actually advertised on the menu or the menu board. Interestingly enough, there was some research done and it showed that it only changed people's food choices about 5% of the time, even when the caloric value of food is listed. So although we'd like to believe sometimes these things have a big impact, sometimes they don't, but you're always the one in charge of your food choices. So really, limiting as much as you can as an individual, the amounts of added sugars and sodium to foods can be helpful. So maybe one day.
Okay, thank you, Jill. Our next question is, there was a question around, is type 2, and I'm going to pass this off to Marsha, is type 2 diabetes an early death sentence?
That sounds like, a bit scary, right? Of course, we don't want to be thinking that, and we know actually that diabetes doesn't necessarily end up being a death sentence. We've actually learned over the years, we've come a long way. There was a really incredible study that was done that I guess it was in the 90s called the UKPDS. And from there, we were able to find out that, in fact, blood sugars were having the biggest impact on the outcome of people's regarding either their risk for a kidney issue or their risk for a eye issues or other sort of complications of diabetes. So what we learned that if we can manage our blood sugars or get your blood sugars managed, then your risk of mortality is much less. So we really, really want to think about this even in a broader sense that, in fact, with diabetes, it's not just that, you're having the condition, you need to manage it. So there's many things that you need to be doing to monitor. And that some of it you're doing on your own because, it's a condition where you have to do some self-management. But in fact, you also have a team behind you. So say, for example, you've got your pharmacist, you have your family doctor, you may have a specialist like an endocrinologist, you'll have a dietitian working with you, a nurse working with you. And we'll be monitoring various things. It might be looking at how to keep your blood sugars in a good place, thinking about taking medications and how to do that effectively, or looking at, ways to work with your food or even your activity patterns to keep you healthy. So I really do think it's not really an early death sentence. In fact, people live long and healthy lives with diabetes, with type 1 and type 2 diabetes. And I really would like to tell you, we've come a long way and we've got a lot more to do. Like, so there's even more coming up. There've been better medications coming out to help protect people's hearts, like these SGLT2s have been really helpful. And that, you know, we're still going further and further. So more to come. So no, I don't think I would be calling type 2 diabetes a death sentence.
Thank you, Marsha. So now my question is, and it's a sort of two-part question, Karen, because we got a lot of questions around water. And we got questions about how much, when, and what kind. Is there an amount that we should be having? And then there was another question around when to actually drink the water. Like if we're looking at, you know, our feeling full, should I have the water before intaking my food so I feel full, or after, to optimize the fiber absorption? And sort of also how long before or after? So a lot of questions, and even the temperature came up of what temperature should the water be that we drink. So
that one sounds very cultural to me. I hear a lot of my aunties and, you know, mom, grandma, right, talk about, oh, you should not drink cold water. But the amount of water really depends on you as an individual. If you're a bigger person, we might need a little bit more water. If you're smaller, we might need a little bit less. It also depends on your physical activity. If you're doing lots of things, you know, you're exercising a lot, you will need more. It's hard to answer that question, but we might suggest that a general range of water intake that we're having in a day could be anywhere between 6 to 12 cups of water. And like I said, it sort of depends on what's happening in your day. We also want to acknowledge that there's water content in our food as well. There's fruits and vegetables that have a lot of water content, or soups and some stews. So that might be where we're also getting that. Really a great way to tell is the color of our urine. What color is it? Is it dark yellow? You know, how many times are you going to the bathroom in a day? So those are some ways to tell. Are your lips dry? Do you feel thirsty? Sometimes we can't rely on our thirst signals as well. And then one that I know a lot of nurses and physicians might use would be the capillary refill. Like how quickly if you squeeze your finger, does it, you know, your blood refill that area that you've been squeezing, so it would turn white into red? How quickly that happens could be a way to tell whether you're dehydrated, right? That's the thing that we're trying to prevent. We don't have a lot of hot days, but certainly in Canada, if we do spend a lot of time outside in a hot location and under the sun, we do want to replenish our water intake very frequently. When to drink water, I would say we want to spread it out throughout the day. A lot of people enjoy drinking water first thing in the morning, and a lot of people don't like to drink water at the end of the day because you don't want to get up and, you know, when you're sleeping and have to go to the bathroom. So definitely there's a bit of a preference for that as well, but certainly hydrate throughout the day. Some people prefer to drink water while they're enjoying their meal or their snack, because it serves as a reminder that that's when that they should have some water, because sometimes you can go through the day without remembering to do so. And for others, it's not really a challenge. In terms of, you know, before meal, after meal, during the meal, I don't think it really matters. There's no change in absorption that we understand, unless you have certain surgeries that were done. If you did bariatric surgery, we might not encourage water intake with the meal because it can sort of make the digestion a little bit different. But if you have not had that surgery or that procedure done, there's no reason not to have water and enjoy it during the meal. Some people like to have water before the meal because it sort of helps them, again, remember. And some find it helpful to manage their portions. Not really the recommendation that I would be giving, because we want to manage our portions, you know, at our mealtime anyway. But it can be helpful, especially if you're if you tend to be a fast eater and you are working on that and trying to eat at a much more moderate pace, a little bit of water intake during the meal can really help with it.
Okay, great. Thank you, Karen. Jill, wonder if you can answer this question. How healthy are low carb diets?
So that's an interesting question. In fact, we have Marsha, Karen, and I have put together a short sort of afternoon Zoom program looking at low carb diets, and our pilot project is coming up next week, but we will be offering that session again, probably in the fall. So this seems to be a new sort of, again, area of fad dieting. And really, it's interesting because many people believe that they are following, quote, low carb diets, but when in fact, I'm not sure there's a very accurate understanding of what carbohydrates are. Carbohydrates are a food group that provide essential nutrition, whether it's from fruit or starchy foods, whole grains. They provide B vitamins and fiber. And if you really are going to cut out your carbohydrate, you are going to be missing macronutrients as a main source of energy for the body. You're also going to be missing out on certain vitamins, minerals, and significant amounts of fiber. Now, there are areas that we can work with individuals in terms of what is a reasonable amount of carbohydrate for you. And certainly people can follow healthy diets that are lower in carbohydrate. In North America, in the past probably 15 years, our carbohydrate portions have increased significantly. And I think that probably stemmed because 20 years ago, we were, well, heart disease is big, so we got to cut back on the protein and the fats. So now we eat too much carbohydrate, and carbohydrate relatively inexpensive to produce, and foods become dense in carbohydrate. So no nutrient should be completely eliminated, in my opinion. But again, on an individual basis, depending on where your priorities are, where you're at with your eating habits, we can put together healthy, lower carbohydrate meal plans, and we can work together individually to do that.
Okay, great. Thank you so much. Formative around that carb, and I know that you guys have been working hard on that low carb presentation and class that's available for people to go to. What about Marsha? I have this question around glycemic index foods for people with type 1 diabetes. Where do you find accurate carb counts?
Okay, so I think it's sort of a two-parter. Because I would think that the glycemic index will be part 1, and then the carb counts will be the part 2. So the part 1, it is really interesting because for some time, I think the glycemic index, which is a tool that sort of ranks the absorption of glucose after eating a meal, like based on sort of how quickly the carbohydrate digests into the system. So some foods can break apart really like rapidly and then a big spike in blood sugar, whereas some sort of tighter together and slowly break apart. So like a lower glycemic index sort of idea. And I think for some while they were thinking this would be more applicable to type 2 diabetes when we have insulin resistance. So a lot of that, I think research was sort of guided towards type 2 diabetes. But in fact, there was a study done in pediatric population where they looked at what would be the impact of using a glycemic index in young kids. And that was sort of the start of that research. And they found out, in fact, it was still applicable in the case of type 1 diabetes when they were using insulin. This still could be a good way to potentially help people when they're managing the carbohydrate load at a meal when you're taking insulin. So I would say definitely glycemic index, can be a tool that people can use, but they still have to consider the amount of carbohydrate they're having at their meal. It may help if you choose lower glycemic index foods to slow the digestion down, which I think can be helpful if you are able to tolerate those foods. And then you can go to Diabetes Canada. Actually, diabetes.ca. So diabetes.ca has lots of patient-friendly information as well. And there's a really nice resource on diabetes.ca called the glycemic index. It's a 4-pager, and it goes by stoplight, like sort of green, yellow, red, and green would be go for low glycemic, yellow, sort of medium, and then low, go slow or pause, and it's a red stop sign. So, and it categorizes the carbohydrate foods based on that. So that might be helpful if you would like to try it out. And then the second part of the question, I know it is something like if you're trying to look also for information on carbohydrate counts, like that can be very helpful when you're managing type 1 diabetes. Sometimes people want to get a sense of how much carbohydrate they're having at a meal, and that may help them even decide on how much insulin to take. So that can be really helpful. And carbohydrate counts can also be found on Diabetes Canada. There was a resource made a long, long time ago. I don't know if you want to try that one, but it's called Beyond the Basics tool. It was this massive, big handout, but it grouped carbohydrate. It grouped all the food groups so that one choice equaled 15 grams of carbohydrate. So I like it for that reason. It sort of helps to look at the different food groups and the amount that would count towards 15 grams of carbohydrate. So all the portions are measured to 15, which can be very, very handy. And then it considers also your food groups to try to include a variety of different foods, which is important because you just don't want to go by carbohydrate counts. You still want to consider, healthy eating and including all the different food groups in your diet. But there are different carb counts out there by Canada. Canada has a nutrient file. I mean, that's available to us. So I would say that's a pretty accurate carb counting place to go to. And there are other apps, like there's lots of apps out there. They're kind of cool, actually, some of them. But there's apps called Carbs and Cals, and they show the picture and you use it like a little scale and kind of like, move up and down on your portion. I've used another one called One Drop, and you can monitor your blood sugar and look at your carb count at the same time and do all sorts of things. And then there's even apps now, believe it or not, for carb counting through AI. So now you can even take a picture and get your carb counts that way. Like it's really interesting. Or you can just send it to your dietitian and we'll try to help figure it out. Because sometimes it's hard to know, like if you're doing a recipe and you want some help, and we can do that with you. And your nutrition label also is going to help you, because sometimes you want to look at nutrition labels to find out carb counts too. So those are sort of some of the things that I'm thinking about when I'm looking for information on carb counts.
Great. Thank you, Marsha, very much for that. Karen, since you were doing a lot of the pantry, and I think this question really can fit right with your talk, is how to keep greens fresh. How do you keep greens fresh?
I mean, definitely using your fridge, right? There are some greens that there is the shelf life right in the fridge that we want to honor. Some ways and tips and tricks. There's some greens we can actually keep in water in a little cup or a vase or a jug of water, and we can stick them in there. So, your mint, your parsley keeps really well in that. Cilantro. Sometimes people find it helpful just to trim the bottom, just to make sure that they're getting good water flow. And also there's another way where you can add some paper towel between lettuce or in your box of spinach. And it really sort of, I think, helps regulate the moisture in your fridge and in the condensation that sort of happens. That's oxidation is happening and the aging process of the greens are happening. So those are some ways that I find helpful. Sometimes I freeze them because I can't use them up, and these tend to be better, again, used afterwards by cooking or in soups and stews.
Great, thank you. Jill,
I sometimes put mine in. I was just going to say, just to add for fun.
Sure.
Yeah, I put mine in the colander. I know it sounds funny, but I have a smaller colander and I kind of whip it around and then leave it in there, and it seems to last a long time. So I've had some luck with the colander and sort of putting in the fridge. I know that's kind of funny to put it in there, but I cut up some lettuce. and
Like
put it in
the salad spinner.
the salad spinner.
Yeah.
Yes, sorry, salad
Yeah.
spinner.
Yeah.
Yeah.
Nice.
I also find just by washing my lettuce or my vegetables and wrapping them in paper towel in a thin plastic bag, like the kind you get in the produce section at the grocery store, I'll often take extra of those. It will keep in the fridge. My lettuce has been keeping for like 2 weeks. So when washed and wrapped in paper towel, so I come home and I wash everything. Same with berries. If I wash them and spread them out on paper towel to dry, and then you can now buy sort of at the dollar store little bowls or dishes, even with berry holes in them. And again, my berries will last in the fridge for quite a while.
I think there's some technology if you're invested in, making sure you're prolonging your produce life as well. Like there's those food vacs, right? Some people have them, some people enjoy them. We do have one. It really helps with the berries. I find that one gets us a lot, right? So those are some ways. And there's lots of videos and tips and tricks online too that I think are actually quite helpful. And I've learned a few over my social media scrolling, right? And it's good to try. Ask your friends.
Thank you. Great points. Jill, I was wondering, there's been a few questions about fasting and points of view on intermittent fasting. I was wondering if you had thoughts on that.
So intermittent fasting can mean many different things. Again, it's been in the media, it's been in research in the last couple of years. Marsha and I have had some students before Karen's time with us do look into the research available on intermittent fasting. And it really depends on what you're talking about. A lot of people are referring to intermittent fasting sort of eating between 10 and 6 p.m. And I mean, I think in many ways that can be healthy, because what it does is really reduce your opportunity or your emotional eating in terms of extra snacking, which often occurs in mindless ways in the evening. When you talk about fasting for full days, there are certainly different medications, different health issues that one would want to address with a physician or a dietitian, specifically to make sure it would be safe for them. So there are pros and cons, as with all different styles of eating. And again, it really depends on the individual. So very much individualized. It can be worked in a healthy way by creating balance at certain times of the day. What you don't want to do is create a situation where you're fasting for long periods of time and then overeating at a time, or mindless eating because you think you're fasting, but you're actually grabbing things later in the day or earlier in the day. So it's really about creating balance. It's about being aware of what you're eating, how much you're having, and when or how often you're having it. It's about, are you going for long periods of time without eating? It's about medications that you take that may play a role in fasting. Are you fasting for weight loss, for personal reasons, for health, for religious reasons? And so we work with people individually to develop what's safe and healthy for them.
Right, thank you. Marsha, I have a question, but I think all of you might chime in. Is the pros and cons of protein powders?
Okay, so it's interesting because there's so much out there on the shelves now and everywhere. Like protein has been a real big topic of discussions, and that probably started happening like when a low carb was really becoming a big hit, and keto, right? That's also been really getting our attention, because before, protein powders were sort of just more for the athlete, but I think it's moved into a different category now, and a lot of people are really wondering about them. And there's many protein powders out there, different, I guess, kinds and what they're derived from, whether it's going to come. Typically, I see more like the whey, like kind of from the dairy, or maybe it can be also like a vegan protein powder. And often what they're, trying to do is give you extra protein or, amino acids and things like that for you to have in your day. So for some people, like, there might be the need, like it might be that you're someone, in the sense, I do think of exercise a lot. I have an exercise background. So I know the commitment that people have to exercise, especially if they do it really intensely. So I know that, people can really be doing a lot of weight training or resistance, like all sorts of activities that requires a lot of demand on the body, and especially if they want to keep their muscles strong. So those types of people might be definitely adding that extra protein in their diet because they're really needing it. Like they probably actually need more. And there are various times when even I think in our lives, like as our appetite fades, like sometimes as people are getting older, people are looking for other ways to get protein in their diet. They may not have the taste or the interest in getting as much protein. Like they might be going through some sort of treatment and they're turned off of all sorts of food. And then, now what am I going to do? I'm looking for a source. Or maybe, they're not tolerating for some reason and they need something more in a liquid form. Like there's different reasons for people to be wanting to get protein. So those might be places where people are getting some protein powder or maybe needing it. Sometimes though, I'm thinking we're getting too much. Like, sometimes it's the other side where in fact we're eating really well and we sort of put this health halo over protein. Like it's just like, this is just gonna do everything for me. And perhaps, sometimes it goes into the category of, well, this is going to help me lose weight. Well, in fact, protein still contributes calories to the diet. And, protein powders can as well, because sometimes there's fruit in there or there's yogurt added and peanut butter and avocado and like all sorts of things get added with these protein powders to make them flavorful, because they might not be that flavorful just on their own. So, I think those are some of the pros and cons that I think about. Now, if Jill or Karen, I don't know if you guys feel you want to add a little bit more to the pros and cons.
I agree with everything you said, Marsha. I think, it's very much a marketing ploy, and the perception is that most people don't get enough protein when in fact, the average person gets far more protein in a day than one needs. We also have to remember that we do get protein from other sources. Many of our carbohydrate foods have small amounts of protein in them. So when you think, oh, I have no protein at a meal, we actually have a little bit hidden in there, which is good. So we don't often need the extra unless it is in specific individualized situations. We also, tend to think of a protein portion as, we think of it as sort of 3 to 4 ounces, but an average piece of chicken breast that you buy at a grocery store, a piece of meat, is often much bigger than that. So we are getting in what we need. And we really don't find in North America that people are lacking in protein. So we do want to be careful about adding in extra when it's not needed.
Okay, so I'm going to add another piece to this question and bring in Karen, because so we had a question around a lot of conditions, but one of them was lupus and sort of good protein amounts for that, and just wondered if you had any thoughts on that and how it affects the rest of the body so I think it just adds very well in here as a question.
Yeah. Before I jump into the answering about, how much protein we need for lupus, I do also, because of my presentation, I want to add that protein powders are expensive, right? So, maybe it's not as efficient with your budgeting and with, the grand scheme of how you're spending your money on a protein powder when you might be getting many other benefits from other protein sources. There is a time and place, but often an average person that doesn't have a lot of dietary restrictions, you're not doing it, plus hours of exercise every day, we might not need as much protein as some of the advertisements are leading us to think. And on certain conditions, something like lupus, we haven't seen any specific recommendations that more protein is needed. In fact, many chronic conditions, we're not seeing that we need more protein. So we would still encourage kind of that healthy protein portions, as Jill said, 3 to 5 ounces, 3 to 4 ounces per meal. It could also look like if you are doing a little bit more of kind of that calorie counting and weight training and that kind of thing, it presents to be about 15 to 20% of your calories are from protein. But generally speaking, I think variety of your protein sources is really important, but because like I said, with many chronic conditions, we need the support of other nutrients. You know, when we're talking about dairy, we're talking about calcium. When we're talking about, you know, our meats, it is zinc or other minerals that we might not find in other items. Grains, we're getting a little tiny bit of protein, getting lots of fiber and other minerals and vitamins that we can't get from meats. So really finding different varieties of our protein sources are our best recommendation for, again, the general public. And certainly I would imagine for lupus.
Thank you. Jill, I'm wondering if there was a couple questions around what's a healthy diet for someone with diabetes.
So that's an area that we the three of us specialize in, diabetes management. The three of us work in diabetes education and have for many years. And there's actually no special diet for someone with diabetes, whether it's type 2 diabetes or type 1 diabetes. It really comes back to what Marsha was talking about, and that's Canada's food guide. It's about eating regular meals, a variety of foods, of course, trying to choose healthier choices more often, foods lower in added sugars and added sodium, foods lower in fat, because heart health is an issue for all of us in North America, and eating regular meals. What we want to minimize is mindless snacking, you know, high fat fast foods, processed foods. We want to include whole grains in a healthy meal planning for someone with diabetes. Portion. It often comes down to not just what you're eating, but how much you're having and when or how often you're having it. And again, these individual or specific questions regarding specific healthcare conditions, diabetes, lupus, if people have GI issues, can be addressed by meeting with a registered dietitian.
Okay, great. Thank you. Does anyone else want to add in there?
I mean, we also, because we work in diabetes, we have lots of classes, and you know, you'll find lots of maybe not lots, but certainly you'll find some posts on Sunnybrook that's written by one of us that sort of speaks to healthy eating. So if you're interested, and as Jill mentioned, there are a couple of webinars that aren't totally diabetes focused, but certainly we do like to address diabetes as a condition because we work with it a lot. But some of those are coming up, and if you want to check out events in Sunnybrook, you would be able to find those webinars.
About diabetes and heart health, like, you know, what we're doing for healthy eating for diabetes, like looking at all the different things that we're trying, leaner proteins, or, you know, not getting as much of the saturated fat. That would be also something you'd be doing when you're looking at keeping heart healthy. So there's a lot of crossover there. Even having a higher fiber diet is good for diabetes and your cholesterol. Like this is all what's going to happen, even preventing and managing diabetes. So we can even think of prevention of diabetes already when we're looking at Canada's food guide.
Great. Thank you, Marsha. Karen, I'm wondering, somebody had a question around, can you tell us about cooking with olive oil? I heard it could turn to trans fat.
Yeah, so not really, but certainly there's something called a smoking point, right, that we want to be aware of. And sometimes heating our oils past the smoking point can change the structure of the oils, and that can lead to damage of some of you know, our cells when we're ingesting them. We can cook with olive oil. We might not recommend cooking with the extra virgin distilled and kind of very refined olive oil. Regular olive oil we can cook with. Also, there's a lot of misconception as to heat, right? So if it's a quick stir fry, you're not super high heat, and we're talking about, you know, 485 degrees Fahrenheit plus, it's really still quite safe to cook with olive oil. And like I said, maybe we would recommend the regular and not the extra virgin olive oil. And then in terms of oils, I think it's really advantageous to use a different variety of oils in your pantry and to have on the go. So other oils that we have often discussed and talked about are canola, grapeseed, avocado, and sesame maybe for some flavoring. So having a variety of oils is really helpful as well, so that you can, for example, heat the grapeseed oil to a slightly higher temperature. Just for reference, the 490, 485 degree Fahrenheit really are barbecue temps, right? And they're really, really high heats.
Great, thank you, Karen. I have a couple more questions. One question is that about supplements. There was a few questions about plant sterols and supplements. Is it a waste of money or is it worth it? And what's your thoughts on supplements? I was wondering if Marsha would like to take that away.
Okay, sure. I'll have a chance at that. So, and then I'll see if anyone wants to add on. So it is interesting because, plant sterol, isn't something so easy always to get in a large amount, but there are some studies out there that have been working with plant sterols, especially when it comes to heart health. There is a sort of a program that was started called the Portfolio Diet that looked at various aspects of nutrition that may be helpful in lowering people's blood cholesterol. And in that study, they actually were using plant sterol, and they wanted to get to 2 grams of plant sterols per day. And in that case, it was hard to do with food alone. So in fact, this is where they used a supplement, and actually they were using it in a margarine. Now that margarine's no longer available. So I know that there's more plant sterols now on the market. So sometimes I have seen that plant sterols are used as a supplement, especially if someone's trying to help, look at managing their cholesterol. So I have seen it used, and I have seen some benefit. So it might be something that's recommended in the case that you're managing your cholesterol. It's not saying everyone's going to be going on to a plant sterol. That's not necessary. This was sort of maybe alongside what your doctor is thinking. You can get some advice and see whether this would be the time to try something like that. I don't know if Karen or Jill would want to add in.
I mean, I think that our idea, and definitely what we strongly recommend, is food first. Can we get it from food that at a reasonable quantity that will make a change, right? There are some aspects to nutrition that really target LDL lowering, soluble fiber being one, healthy fats from olive oil, nuts and seeds, fatty fish can be a way to help your cholesterol as well. And, definitely if none of those are helping you to the target that maybe you need to or are encouraged to get to, then the plant sterol supplements could be another trial as well. And again, I always, for all supplements, encourage food first. And then the second thing is it within your budget?
And I'm going to add to that as well, in not just plant sterols, but other supplements. So vitamins and minerals, if you're generally eating a well-balanced diet, you've got a large intake of vegetables, fruit, whole grains, there isn't a specific vitamin or mineral that you will be lacking or missing. The only supplement that we generally recommend is, because we live in North America, we don't get enough sunlight, especially this year. It's been in the news a bit. I think it's been the darkest year in 50 or 60 years, something like that. So we do all need some vitamin D, and that should be taken regularly by everybody. Otherwise, specific supplements, as Marsha and Karen have pointed out, plant sterols, omega-3 fatty acids, omega-3 6-9 fish oils are quite individualized because it depends on individual tolerance. Can you get it first from food? How much are you getting from food? Where are sort of blood levels maybe lacking, or where can they benefit? And so again, this is where talking to a dietitian who has the knowledge, who has the background, who has the support of the college and scientific information behind them to provide that credible information on whether it's appropriate or not for you. But as Karen and as Marsha have said, food first and general healthy eating, variety of foods is going to give you all the nutrients that you need in general.
Well, thank you, everyone. We've come to the conclusion of our question answer period, and I just have a few more points before we wrap up for the evening. Please be sure to take a moment to fill out the electronic evaluation form. This will help us for planning future talks and topics for you. You can also add your name to our mailing list for future talks. I'd like to thank our incredible speakers once again for this really informative evening. And a big thanks to all of you for joining us for this discussion. Please be sure to check out our upcoming topics, which will be shared on this speaker series website, and have a wonderful evening. Thank you.